Did you know that one of the most powerful weight loss medications available today no longer requires a needle? For years, weekly injections stopped a lot of people from even starting obesity treatment, even when the science was solid and the results were impressive. Some delayed care, others never started at all. Now that barrier is starting to disappear. Today, you'll learn exactly what the Wegovy pill is, how it works inside your body, how effective it really is, what side effects to expect, and how safe it is for long-term use. And later, we'll clarify who this medication is actually meant for, because that's where most of the confusion happens. Let's start with the big question everyone is asking. What is the Wegovy pill, and why is everyone suddenly talking about it? The Wegovy pill is an oral version of semaglutide. That's the same active ingredient used in injectable Wegovy. Semaglutide belongs to a group of medications called GLP-1 receptor agonists. These drugs have been used for years in the treatment of obesity and type 2 diabetes around the world. Until recently, if you wanted the most effective GLP-1-based weight loss treatment, injections were basically the only option. Weekly shots. And for many people, that alone felt like too much. Some postponed treatment, some never considered it at all. The Wegovy pill changes that dynamic. Instead of a weekly injection, this is a once-daily pill. No needles, no injections. And it's specifically designed for chronic weight management, not short-term or cosmetic weight loss. That distinction matters more than most people realize. Now, let's talk about how this medication actually works inside the body, because once you understand that, everything else makes sense. To start, you need to understand GLP-1 in simple terms. GLP-1 is a natural hormone released in the gut after you eat. Think of it as a messenger. It sends signals between your digestive system, your brain, and your pancreas, helping your body decide how hungry you feel and how food is processed. The Wegovy pill mimics this hormone, and when it does, several things happen at the same time. First, it reduces appetite. It acts on hunger centers in the brain, helping you feel full sooner and stay full longer. Not overly stuffed, just comfortably satisfied. Second, it slows stomach emptying. Food stays in the stomach longer, which means hunger doesn't come back as quickly after meals. That constant urge to snack often fades. Third, it improves blood sugar regulation. When blood sugar rises after eating, semaglutide increases insulin release. At the same time, it reduces glucagon, the hormone that raises blood sugar. This is one of the reasons GLP-1 medications were originally developed for diabetes care. And fourth, something many people don't expect. It may reduce cravings and what many describe as food noise. Those repetitive thoughts about food, the pull towards certain foods even when you're not physically hungry. GLP-1 medications influence reward pathways involved in eating behavior, which can make eating less feel natural rather than forced. Oh, and if you're enjoying this video, make sure to hit the like button and subscribe to the channel so you don't miss our next health tips. Let's dive back in. And here's a key difference. Unlike older stimulant-based weight loss pills, the Wegovy pill does not speed up the nervous system. It doesn't raise heart rate artificially. It doesn't rely on constant appetite suppression. It works with the body's existing hunger and metabolism signals. That's why it's intended as a long-term treatment, not a quick fix. So what kind of results can people realistically expect? How effective is the Wegovy pill for weight loss? Clinical trials of oral semaglutide for weight loss show results that medical organizations consider clinically meaningful. In large, randomized studies, participants lost around 15 to 17% of their body weight over about 68 weeks. That's more than a year. A significant portion lost 20% or more of their starting weight. And the strongest results were seen when the medication was combined with nutrition guidance and regular physical activity. These outcomes place the Wegovy pill in a category that used to be limited almost entirely to injectable therapies and even some surgical approaches. That's a major shift, but it's important to be realistic. Not everyone responds the same way. Some people lose more, some lose less, and a small group may not respond at all. That's not a personal failure. That's biology. Now let's talk about side effects. What should you expect with the Wegovy pill? Most side effects are digestive, which makes sense given how the medication works. The most common ones include nausea, diarrhea, constipation, bloating, and reduced appetite. For most people, these are mild to moderate, and they tend to appear during dose increases. As the body adapts, they often improve. That's why healthcare providers increase the dose gradually over time, instead of starting at the full amount. There are also less common but important side effects to know about. These can include vomiting, acid reflux, fatigue, and dizziness. Adjusting the dose slowly helps reduce these risks, and symptoms are closely monitored. Now, let's address the big question about safety. Is the Wegovy pill safe for long-term use? Based on current evidence and regulatory review, it is considered safe for long-term use when properly prescribed and monitored. Its safety profile is consistent with injectable semaglutide. There has been no observed increase in serious cardiovascular events. In fact, GLP-1 medications may reduce cardiovascular risk in certain populations. That matters, because excess weight itself increases the risk of heart disease, stroke, and other metabolic complications. That matters, because excess weight itself increases the risk of heart disease, stroke, and other metabolic complications. Now, let's talk about who this medication is actually for. The Wegovy pill may be prescribed for adults with obesity, defined as a body mass index of 30 or higher. It may also be prescribed for adults who are overweight with a BMI of 27 or higher when there are weight-related health conditions involved. These can include high blood pressure or abnormal cholesterol levels. High blood pressure increases the risk of heart attack, stroke, and kidney disease. Abnormal cholesterol raises the risk of clogged arteries and heart disease. In these cases, weight treatment is medical care, not cosmetic. However, the Wegovy pill is not appropriate for everyone. It should not be used during pregnancy or breastfeeding. It may not be suitable for people with certain gastrointestinal conditions, and it is not intended for short-term or aesthetic weight loss. This is about long-term metabolic health. Another question that comes up frequently is how the pill compares to injectable Wegovy. Here's the simple breakdown. The Wegovy pill is taken orally once a day. Injectable Wegovy is taken once weekly. Some people prefer avoiding needles, others prefer fewer doses. Effectiveness is considered comparable when taken as prescribed. Adherence depends on the individual. Neither option is universally better. The right choice depends on medical history, daily routine, and personal preference. And that's exactly how treatment decisions should be made. Now let's zoom out. What does this new option really mean for people living with obesity? The Wegovy pill represents more than convenience. It reflects a broader shift in how medicine understands obesity, not as a lack of discipline, not as a personal failure, but as a chronic condition influenced by hormones, genetics, environment, and metabolism. For many people, removing the barrier of injections may finally make evidence-based treatment feel accessible, and access changes outcomes. Before we wrap up, one important reminder. Did you know that many people have high blood pressure? The best way to control it isn't just medication. Natural approaches can make a huge difference and improve your quality of life, even if you don't have hypertension. That's why we created our ebook, Hypertension Made Simple. Everything you need to know to control high blood pressure. Inside, you'll discover things your doctor may not have time to explain during an office visit. The link to get your copy is in the description below. Now, let's get back to it. Here's the takeaway. The Wegovy pill is not a miracle cure. It doesn't replace nutrition, it doesn't replace movement, and it doesn't replace medical guidance. But for the right person, it can be a powerful tool, a safe, effective, and more approachable path toward better metabolic health. Without needles, without shame, and without pretending that obesity is simple. And if you found this video helpful, don't forget to like and subscribe so you don't miss our upcoming health videos. Thanks for watching, and see you next time.